My name is Akhiwe. I live in Yanga. I'm 12 years old. I'm going to speak about my eye infection. I think it was last year, October or August, between these 2 months. I had an eye infection. I woke up and then my eye was blasted and I didn't know what to do. I couldn't watch TV. I couldn't look at my books. I couldn't read my spellings, and I used to cry all day and ask my mother that I am going to have one eye. And then her answer was always, she promised, no, you're not going to. When I used to look at people and then they had two eyes, and then I used to think, I'm going to have one eye. I'm going to survive with one eye. My mother said I must come to Red Cross Hospital. They sent me to eye clinic, and there's something that called a pass. After that, they took me to ward B1. After that, I was isolated. After I was isolated, I think they wanted to do me an operation. I could not open my eyes, and when I opened my eyes, like everything is yellow. But my mother said that I must not do an operation. Now I'm gonna interview my mom, Tandika. Can you please tell me about yourself?
My name is Tandeka, the mother of Akhiwe. I'm working in the EC project in Red Cross Hospital.
How were you feeling as a mother with a sick child?
I was nervous. I was scared, but I had to be strong at the same time. And I didn't want to panic because maybe I would cause everyone to panic. But to be honest, it was not a good experience at all. I had to get involved as a mother and ask questions that the doctors were asking because I think you were in pain.
Tell me about the staff. Were they good, or did they manage to help you?
Yes, they were good because the way you were, imagine, because you were complaining about the side of a headache. You didn't want me to touch you. While the pus was coming out, you didn't want me to wipe you. But they managed to do the things that I couldn't do to you. The way they make you so comfortable, you change from when you're driving from home to hospital with a sick child, then you get here, the warmth, the way they welcome you here. That is why I take that step, that the only people that I know they can help me is those ones in Red Cross. That's what I can say, and thank you.
Thank you for coming. When I was in hospital, my nurse was Kanye. Kanye is like my godmother. To have Kanye by my side, it made me feel like coming to hospital each and every day. Now I'm going to interview Sis Kanye. Why was I isolated?
So with the eye problem, sometimes it's contagious. So the reason why the patient get isolated is to prevent the other patient from getting the disease or the infection, and to also protect the patient from other patients because their immune system is low and they can just get infected easily with other things.
Was I taking so much medicines or few?
It wasn't a lot of medication. It was for pain, which was the Panado, and the Brufen also, which was also for the pain. And then you got antibiotics to treat the infection, and then you also got the eye ointment to treat the infection also.
Thank you for coming to the interview.
And thank you for having me.
After 2 days, I got healed. I felt very, very much happy. When I found out about RX Radio, my mother used to make me a tour. She explained about RX Radio. And then she asked me once, do you want to join RX Radio? And then I said, I don't know, because I don't know what I'm going to be when I grow up. And then she said, I have to think properly what I want to be when I grow up. After Wayne WhatsApped my mother, and then she asked me, if you want to go, you're going to have many experience in RX Radio. And then I said, okay, I could give it a try. I decided to do the RX Radio. It has been fun.